Take a look at what's coming up next.
The health and well-being of those affected by HIV, hepatitis C, and other sexually transmitted diseases is of utmost importance. But sometimes those who need care the most are afraid to seek it. Luckily, there's help.
CAN Community Health is an organization that was started in 1991 in Sarasota, Florida by our founder, Susan Terry. It was really based around the AIDS epidemic in the 80s, and she founded the organization to help those that she loved and those in the community. And we have continued that mission throughout now to present day. Stigma is one of those things in society nowadays where people fear to receive treatment out of fear of being judged, of being diagnosed by being HIV positive, or even just seeking treatment to prevent HIV or STDs. So one of the things that we work for here at CAN Community Health is to be able to break that stigma and break the barriers to care and have individuals receive that treatment. One of the ways we provide our services is through our mobile medical units and our mobile testing units. Those units are actually able to go into rural areas where individuals that are wanting care but are not able to actually physically come into our locations.
Times have changed since HIV/AIDS was first discovered decades ago.
With today's technology, with today's medicine and the quality of care that we provide, HIV is now controllable and patients are able to live a normal and healthy life. Our staff are credentialed in not only prevention efforts, outreach, medical support, people living with HIV that are there to help navigate a newly diagnosed HIV individual. And with the credentials that we have through HIV-specific certifications, through infectious disease doctors, primary care doctors, internal medicine doctors, and a full gamut of services and support staff, an individual can come and get their care here at CAN, from their medical care to their pharmacy services, dental, behavioral health, substance abuse, all the full gambit of services that an individual may need if they're living with HIV. No matter if they're heterosexual, homosexual, LGBT community, African American, Hispanic, Caucasian, at the end of the day, HIV does not discriminate. We want to make sure that we have access, that we provide access to care for individuals regardless of ability to pay. That is extremely important because we want to make sure that individuals are getting the care and services they need without having to worry about their copay or how are they going to pay for some type of care that we can provide.
Thomas should know he's a medical peer navigator living with HIV.
So my journey began 28 years ago, and I struggled in the beginning, but then I went into doing missions work overseas until I met a medical peer navigator at CAN, and my life's never been the same again. Medical peers are people living with HIV/AIDS who are trying to help others live adherent and productive lives. Our guiding principles here at CAN are really simple. We wanted people to remember them easily. It's CARES, which is communicate. We want to advocate, do plenty of research, execute the plan, and then have it be sustainable. It's the way that we guide everything we do as an organization and personally.
Prevention, testing, peer talk, medical care. This is where they all come together.
HIV and AIDS are not the same thing. It's a common misconception. AIDS is the acquired immune deficiency, which is a manifestation of having the HIV virus. And that is when your immune system is sufficiently affected to put you at risk of different types of infections. We have two therapies to prevent infection with HIV. One is called NPEP, pre-exposure prophylaxis, where you take a medication every day to prevent infection with HIV. That is recommended for patients that lead a high-risk lifestyle of HIV infection. We have NPEP, which is post-exposure prophylaxis, therapy to prevent HIV infection if you have an occupational exposure, such as a needle stick or a high-risk sexual encounter. You need to get to the doctor early, before 72 hours, and we start you on therapy.
Together as a society and as a community, we're able to make a difference, to come together, to break the stigma and break the barriers to care, to give healthcare to those that need it most.
You can lead a normal life if you are tested and treated early.
We're not only here for you, we're here for those you may love as well.
On a final note, education is prevention and prevention is power. It is our goal to make sure that we educate individuals so that way we can prevent further infection spread.
For more information about CAN Community Health, visit cancommunityhealth.org or just go to our website, thebalancingact.com.